Hey guys, my name's Jen Slade. This is Go Cup Yourself video number 4, and in it we're going to talk about marking up from cupping. So this is one of my favorite conversations to have. It's a super important topic to discuss for a multitude of reasons. So I'm really excited to dive into this a little bit today with you guys. So to start out, marking is really a unique feature to cupping. It's something that a lot of people are really only aware of cupping because they've seen the marks. And so cupping is a very unique therapy in that there are not many therapies out there that leave a physical mark on your skin after a session. And I think this marking can turn a lot of people off from cupping. And on the flip side of that, it can also bring a lot of people to cupping because they're curious or they're interested. And in my practice, I've certainly seen both sides of that play out. In regards to cupping therapy, I still have clients who want to get cupped and they are just too afraid they're going to mark up. So hopefully this will help shine a little bit of light on what a cupping mark is, why it happens. I'm going to get a little bit into the biochemistry of it because I'm a science nerd. And so yeah, I've got a lot to say on this topic. So I'll try not to talk for 30 minutes because I don't think anybody wants to listen to me talk about cupping for 30 minutes. So anyway, to get started, I want to talk a little bit about the history of cupping, just to touch on. So many of us, probably most of us, are familiar with cupping thanks to acupuncture and traditional Chinese medicine. And I am so grateful to TCM because of this, because it has brought such a wider awareness of cupping to the West. And I think we hear a lot of cupping terminology discussed in terms of TCM, like TCM terminology. So we might hear blood stagnation or chi stagnation or different concepts that are very specific to TCM. And I want to just reiterate, or just not reiterate, but just put it out there. I am not a traditional Chinese medicine practitioner. I am a massage therapist, and I am a pre-medical student, and so in my work, in my cupping practice, I take a very clinical stance. I take a very biomedical based approach to cupping therapy and to marking. So you might hear different things about what a mark is or why it happens from different practitioners depending on their school of thought and their training. And that's really interesting because that leads to a lot of communication and a lot of conversation in the field of cupping therapy because there are so many different thought processes and different schools of thought that go into this pool of knowledge. So I want to just kind of put that out there. So what I'm saying is what I believe to be true from my own studies. I have taken countless cupping courses, I have read books, I have read journal articles, I have had a lot of practice, I study biochemistry, I have looked at this from so many different angles, and so this is what I have decided I feel the most comfortable sharing as far as what a cupping mark is. But just know that there is some conversation out there still, and everything I say here might not be 100% true. It's just what I believe to be true. So yeah, just want to kind of put that out there. And so, while TCM is the most common for making, or the most has made cupping the most common here in the West, cupping is not in any way, shape, or form exclusive to acupuncture and Chinese medicine. There's historical texts and historical artifacts, for lack of a better word, I guess, that lead us back to seeing cupping practices in ancient Egypt, in African tribes, in Native American tribes, in Europe, in I believe Russia, the Mideast. Cupping has been practiced all across the world for hundreds and hundreds of years, probably thousands of years. So this is definitely not anything that came exclusively from TCM. So I just want to kind of put that out there too. I love TCM and I'm so inspired by it, but it's not what I practice, and it's not the only body of knowledge on cupping therapy. So anyway, want to put that out there. So getting off of my little spiel there, moving into the process of cupping. So what actually is happening during cupping, we have negative pressure pulling up on the tissue. And it creates a rapid state of diffusion in the tissue. So things are being pulled up to the surface. So what we're seeing mostly coming up to the surface, that's what's being pulled up. It's not a bruise that's happening on the site like that. What's being pulled up is actually anything that's been stuck in the tissue. So it's mostly blood, and it's blood that's either been stagnated or just that was in the area to begin with. We also will see different molecules get pulled up to the surface. So biomolecules, so we're thinking like lactic acids, different types of cellular debris, metabolic waste, and in addition to that, environmental toxins. I hate the use of the word toxins, but for lack of a better term, just kind of think of it as a little bit of an umbrella here. But environmental toxins, pharmaceutical residues, and things we might have picked up in our water, our food, the air we breathe, things that we're exposed to. There are so many different things that can bioaccumulate in our bodies and our tissue. And so some of these things get trapped in the tissue, and with cupping, it can help be released. So one of my favorite stories to tell, I have this client who tastes metal in her mouth every single time we cup a certain area on her low back right along her spine. And it's happened so many times, and finally I sat down and was like, I want to look into this. So I did some research, and I actually found that it's a known thing that epidurals, a little bit of the anesthesia, the medication, can be trapped in the tissue after having an epidural, and that when released, you would taste metal in your mouth. It's right on the spinal cord, so I assume it goes to the brain and then registers in the mouth as a metallic taste very quickly. And so this is really cool because this woman had an epidural when she had her child over 20 years ago, and she still tastes it every time, which is just fascinating. And over time, with frequent cupping of that area, she would probably taste it less and less because we're clearing a little bit from the tissue every time. So that just goes to show you how powerful this is, and this is real. That things are being pulled up from the tissue, and they're pooling just beneath the surface of the skin in the dermis. There's also a little bit, I believe, of superficial capillary rupture that happens at the surface, which also contributes to the redness. However, it is nothing to be concerned about, and I do not believe that that is by any means the only basis for marking up from cupping. So what I really, really want to drive home here, though, is that this is not a bruise. A cupping mark is in no way, shape, or form a bruise. A bruise would imply trauma to the tissue, and a cup in no way, other than a little bit of mild capillary rupture, potentially, a cup is not going to cause any kind of damage to the tissue whatsoever. So when things get pulled up to the surface, it's just going to pool there. And so the blood that pools, so when this trauma, essentially, it's a non-trauma, but when this experience happens in the tissue, blood will pool into the area, specifically hemoglobin and myoglobin molecules. Myoglobin is a muscular molecule. It's found only in muscles. That it's very similar to hemoglobin. It's an oxygen-binding molecule. So myoglobin and hemoglobin rush in, they flood the area, and then they sit underneath the surface in the dermis in the exact same way that a bruise would. So if there's trauma to the tissue, or if there's a rapid state of diffusion where things are getting pulled up to the tissue, either way, blood is pooling underneath the surface right there in the superficial dermis. So what's going to happen to those molecules as they oxidize, as they fade out, as they're cleared by the lymph and by more superficial blood vessels, is that they're going to change colors. And so they are going to fade out in the exact same way that a bruise would heal. And this is because that's just how blood oxidizes and how blood clears when it's sitting at the surface of the skin. It's not, so it'll look almost identical to the way a bruise would clear, but it is not the exact same. The blood isn't there because of the same reason. However, it's going to clear the same way a bruise would heal because that's just the biochemical process that allows that to clear. And so when we see a bruise, we'll see, that like reddish purple at first. The bright red we see at first because it's oxygen-rich blood. And then as the oxygen molecules are either reabsorbed or cleared from the area, we see that change to a purpley blue color. And then we see that yellowish color, which is due to bilirubin, which is a metabolic product of the breakdown process of those molecules sitting at the surface. And we also might see that greenish color sometimes too, which is due to biliverdin, which is also a molecular product of the breakdown process. So we see these marks clearing out the exact same way a bruise would. Biochemically, that's what's happening in the tissue. We wait for the lymph to come clear things. So I often tell clients after a session, if you drink more water, it should help your marks to clear a bit faster, because that just, the more hydrated you are, the more your lymph is going to be able to move efficiently. So that is molecularly what's going on, and in the tissue, that's what a bruise, or that's what a cup mark is, and that's why it looks really, really similar to a bruise. So moving on from there, moving on from there, I have notes. So if you're like, what the heck? I want to talk a little bit about how long cupping marks last. So this is so variable across so many different body types for so many different reasons, really coming back to your unique biochemistry, your individual factors, any reasons, any toxicity, like I said, I hate that word, but for lack of a better term, anything in the tissue that's going to lead to you marking up. So if you've got a lot that comes up to the surface, it would make sense that it's going to take a little bit longer for that to clear. And some people just have a slower lymph flow. Some people aren't necessarily as active, and so the blood isn't really getting into those areas as effectively, or as effectively as quickly. So those are all factors that could influence it. If you have a cup mark that lasts for 2 days versus one that lasts for 2 weeks, it's not good or bad. It just is your unique body, and some people will just clear a lot faster than others. In general, the average is anywhere from probably 3 to 4 days to about 2 weeks. It's definitely possible to have cupping marks that last longer than 2 weeks. However, it is not terribly common. And if you do have marking that lasts longer than 2 weeks, in general, it's very, very faint and you almost wouldn't even notice it. But it is possible. Most people, their marks clear pretty quick, probably on average around a week or so, and you probably won't have much left after that point. Which also brings me to my next point. Not everybody marks up. Actually, a significant percentage of the people that I work on don't mark up at all. And it has a lot of reasons as well. Primarily, my Bluetooth speaker just went off. Primarily, the intensity of the suction used. Again, what's going on with your tissue? There are so many different factors that will go into why you may or may not mark up. And at the end of the day, I want to mention that, like, there's no good or bad. There's no like, oh, I didn't mark up at all, so like I'm super healthy, and oh, I marked up a bunch, so I'm super toxic. Like, no. And like the flip side of that, that's not. There are so many different factors, and there are patterns I definitely recognize. Like, for example, I see that bodybuilders or really hardcore athletes don't tend to mark up much at all. You would probably think the opposite, right? All that lactic acid, all of that like working out. But what my theory there is that the tissue is so dehydrated or restricted that the blood really just can't effectively get up to the surface through the fascia and the other layers of connective tissue. So again, that's my theory, but that's definitely a pattern I notice. I see people who are on heavy pharmaceuticals tend to mark up a lot faster. I've worked with a lot of people in recovery who tend to mark up a lot faster or a lot darker because there's just more going on in the tissue. So it really kind of depends. And what's one thing that's really interesting too is you may mark up kind of dark at first, and then in subsequent sessions, you will mark up less and less. Like you will mark up less and less over time because there's just been more that's been cleared from the tissue. And maybe in the time between your first cupping session and your next cupping session, what's going to come up in that following session is going to be what's accumulated since the last time you were in, and what was not totally cleared the first time. So you will mark up less and less over time, which is also another interesting point that goes to elucidate the whole it's not a bruise thing, which is not a theory, it's a fact. But so that's just a really interesting kind of conversation to have too. There's a lot of different reasons why you may or may not mark up, and it doesn't necessarily mean that you're good or bad or healthy or not healthy. And again, there are so many factors that play into that. And if you're curious, that's something I definitely could do another video on, or we can talk about directly. So I am going to cut myself off there because I think I'm at about 15 minutes. If you listen to this, you are a trooper. I appreciate you. Keep your eyes peeled for more Go Cup Yourself videos to come in the future. I'm working on some fun ones. And thank you so much for tuning in. Have a beautiful day and take care.